And you wouldn't believe the baby boom we had 9 months later. Well, you just have to develop that hand muscle. But the hospital history is not that proud when it comes to racial matters for either facility. If I was the guy that would change my religion just to get a job, you probably wouldn't want me anyway.
Right.
The reality is that Lynchburg at that time, and even today, doesn't have the population base to support that level of care. At one point, there were 7 or 8 or 9 hospitals in Lynchburg. We had flash strips hanging on the OR lights because the flies would come in the front door and come all the way through. It should not be the case that because I'm privileged, I get that treatment. And somebody who lives somewhere else in Lynchburg, because they have different circumstances, they don't get health care. But hospitals in Lynchburg are going to be close to the bone. They are going to be struggling. How I just wish, as a country, we could not talk to each other, but listen to each other. I think we do plenty of talking.
Mm-hmm.
There's just not enough listening.
Welcome to another edition of No Holds Barred. I'm Rich Roth, and my guest today is George Dawson, former CEO at Centra Health. And man, George, the more I learn about you, well, first of all, thank you for joining me today.
Thank you. Nice to be here.
I'm excited to talk with you, about what you've done in your tenure at Centra and all the different things that have evolved in the medical field, but also all the stuff that you've been involved with, you and your wife, Rosemary, as well, involved in the community and staying here in the Lynchburg area, and awful lot to talk about. I'm excited. Thank you.
Thank you. Glad to be here.
First of all, let's throw this out. Today is, we're recording this interview on September 11th, and I know you served in the military, and we can start there, but, a very, very significant, impactful day in our country's history. And glad to see remembrances that are still going on, but it seems like they're fewer and farther between. Talk a little bit about this day and what it means to you, especially having served in the Army. It's been a
hard day for me. I've been thinking about 9/11 since I got up this morning. And, 24 years ago, since terrorists came and killed Americans, and now Americans are killing each other. Last night, Charlie Kirk's assassination, and so many others across the political spectrum that it's been a very pensive day for me, to tell you the truth. Probably because I knew you were going to ask me about that too, Rich. So, but yeah, I was in the Army for 4.5 years.
Talk about your service and what you did. I understand a Bronze Star.
Well, yes, for service, not for valor. So let's not overstate that.
I mean, 4 years of service, that can't be understated, really, in this day and age, I think.
I graduated from college in 1968. I graduated from high school in 64. And that was before the lottery. The lottery came along a little bit after, a year or two after my graduation. So the draft lottery, not the $1 million jackpot lottery. But in my era, I was in ROTC in college, as were essentially every male in my college was at ROTC, unless they had some physical ailment or deferment because of physical health. And so when my last couple of years in school, I was lucky to have a ROTC Advanced Scholarship. I was chosen as one of a few students to have that. And so that gave me a regular Army commission when I finished college, and I went into the Medical Service Corps, which was sort of the support corps for the Medical Corps and the Nursing Corps. And
is that something you had a choice in?
I did have a choice. You were assigned a branch. You could request a branch. I think, frankly, as a regular Army commission instead of a reserve commission, I had a little bit of a leg up, a little more points in my favor. That led 4.5 years in the Army working in Army medical treatment facilities, doing a variety of things. And then from there, that led into graduate school in my profession for many years. So it was interesting.
When you joined the Army and got, put in the situation that you were in, you weren't necessarily interested and had studied and were pursuing a career.
Well, I was.
Or were you?
Yeah, I was a science major. I was a biology major and a chemistry minor, and was maybe going to go to medical school, maybe to go into research biology, maybe into marine biology. A lot of maybes, but I knew I had my military. At that time, you had either 2 or 4 years to figure that out because you knew you were going to go in and serve. And actually, we had 4.5 very good years. My wife and I got married. I started my active duty actually in the spring of '69 and was in the Army, until '73. Did a couple of years near Chicago at Fort Sheridan. Did a year in Vietnam. Did a year plus at Fort Campbell, Kentucky. Was at Fort Campbell when the 101st Airborne Division came home, and which was a momentous occasion. The 101st Airborne was, really screaming eagles. They were a very elite Army Corps, and they all came. Yeah. They were based at Fort Campbell, and they all came back. I was working at the Army Hospital there, and you wouldn't believe the baby boom we had 9 months later. Should have planned better for that one. Should have planned better.
What was Vietnam like for you?
It was pretty good. I went to Vietnam. I was went in the Army as a second lieutenant. I was a captain in Vietnam. I had a job my job was to coordinate medical evacuations from Army hospitals and with the Air Force, and to move wounded soldiers from Vietnam or the field hospital they were in, back to a hospital somewhere in the Pacific region, depending on what their needs were. So, we would say, okay, we got 6 neurosurgical beds in Okinawa. We got, we've got orthopedic beds here. We would coordinate the arrangement, the pick up, the fly in, the fly out. And my unit, the group of guys that worked for me, we handled the pad for the 95th evac, so the helicopters coming in and out of the 95th evac. And then I would go out, start at it with the northern half of the country. So I would go out and visit the Army hospitals every week or two. I would fly out from our Da Nang base camp to one of the hospitals to kind of work with their administrative staff on what their needs were. So,
and really just more in terms of figuring out how many beds were available for what types of patients.
That's right.
And then
that's right.
Coordinate that.
Yeah. Today, a reasonable laptop could do the whole job. But it was a growth experience. I mean, at that point, I'm 2.5, 3 years out of college, and with a dozen or two guys working for me, enlisted men, and some responsibilities and relating to a lot of different. So it was a learning opportunity.
So what you did in Vietnam relative to what you did when you were stationed stateside, was it similar? I mean, obviously there was no war going on here.
Yeah, my first job in the Army was as a medical supply officer for a medical unit in the Midwest, and so I was the officer in charge. I had a supply sergeant and some civilians and some enlisted men working for me, and we supported, ordered, inventoried, delivered the supplies to 6 or 8 different medical facilities, dental clinics, as well as health clinics throughout at Fort Sheridan, but also. And then I had a stint I had a stint as a company commander where I was the commanding officer for the enlisted troops that served and covered the military dispensary and dental clinic at Fort Sheridan. So I had about 60 guys in the barracks and different responsibilities, some married, some unmarried, but, you know, a lot to learn. Had a great first sergeant who, you know, as long as I would listen to him, he would keep me straight. Here I was, you know, a 25-year-old, I guess, 22, 23, 24-year-old guy.
And you're in charge of 60 people.
Yeah, I had. I remember just a quick story. We'll move on, but I have a recollection. I would have some wives come to see me, and they were concerned because the habit was that their husband I guess they were husbands at that time. You know, they were living on post with a couple of kids and a family. But the paycheck would come in, and the guys would go downtown to Chicago, and pretty soon
the paycheck was gone.
Yeah, the paycheck was gone, and there weren't any groceries. And, so, you know, here I was, like, responsible for, you know, what do I do about this? So I called those 2 or 3 in and their spouses and sat down and worked out a family budget and just said, okay, you know, I've got summary court-martial powers. I can do a summary court-martial, but I said, let's just agree that I'm going to get your paycheck. I'm going to give you so much allowance, you know, specialist so-and-so or private so-and-so, and the rest I'm going to give to your wife to buy groceries every week. So here I am at 23, 24 years old.
You're a financial advisor, too.
Yeah. And somebody's daddy, and it was pretty good, though, yeah.
Wow.
So the Army was, it was good for us. And then we came back, and we were at Fort Campbell. I was headed up a lot of the records in the medical records departments and a lot of the disability hearings and things like that. There was a MOS, a job specialty in this category I was qualified for. And so the question was, do I go to graduate school? The Army wanted to send me to graduate school, but that would be 3 or 4 years plus a payback year for year. So by the time I finished that and did the payback, I would be at 12 or 15 years or 10 or 12 years of service. And it could be hard to get out then because you're getting close to 20. So we decided, do we stay or do we go? We decided to come back and come back to Virginia and go to graduate school. I liked the field. I liked the work. I thought I would try it as a civilian. So I went to the Medical College of Virginia, got my master's degree in hospital administration.
So it really was your time in the Army that led you to where you wanted to be as a hospital administrator.
That's true. Who knows?
You never know.
Who knows? Yeah.
The financial advising thing, was it the route for you?
Yeah, I don't know. I mean, I might have been selling insurance. It could have been a good thing.
So you go to the Medical College of Virginia to get your master's in hospital administration.
Yeah.
Tell me about winding up in Lynchburg.
Well, you know, my wife and I both are from Virginia. We grew up in a small rural community in Northern Virginia when such things used to exist.
Yeah, I was going to say that.
They're not there anymore, but I got up every morning before school and milked the cows, actually. Had 20 acres there, and my dad worked in town, works for the State Department, but my mom was very much a farm girl. She was from Crozet, and I was born in Crozet. So yeah, we after graduate school, that was, 20 months academic work in Richmond, I think 20 months, and then a year in a administrative residency on-the-job training, which I did in Wilmington, North Carolina. And from Wilmington, I then took my first post-Army job in Tennessee, and I was in Kingsport, Tennessee for 5 years with a large hospital, and started there as kind of the only assistant administrator. By this time I was, 28 years old or so, and worked my way up and had a chance to do a lot of things at Holston Valley Community Hospital in Kingsport. And then heard about the opening at Virginia Baptist. So threw my hat in the ring and went through a selection process and interviews and ended up here when I was starting as the executive director of Virginia Baptist Hospital in 1980 when I was 34 years old.
Wow. Wow. All right. I want to get into that, but I've got to back up a little bit. Milking cows, growing up on a farm. My mom did as well.
Yeah.
And the work ethic that you develop, sun up to sundown. I mean, always doing something. I mean, milking cows. I've never milked a cow. What's that like?
Well, you just have to develop that hand muscle. Yeah, we had. There were 5 kids in my family. My mom was a stay-at-home mom, but was very much involved her whole life in whatever the kids were in, and was a wonderful mom, and could do anything. And she had a job for every kid, and she always had a project going on. And looking back at it, part of it was because she wanted to teach us to have a strong work ethic, like you said. The other part is with 5 kids, she just needed some way to have sanity. So, yeah, I mean, it would be. I remember when we put in a new lawn at the house, she gave every kid a bucket and said, "Okay, I want you to go out there before we put the seed down and pick up rocks. And for each rock you pick up, or I'll pay you so much a pound or a penny a rock." I've forgotten exactly, but it was. And I thought, well, what an ingenious way to teach us to work. But no, I think she just needed time to cook dinner, But yeah, so I milked in the morning, and my older brother milked in the afternoon, or my younger brother, depending. And that let me play football. I played high school football and some other sports, and was in the 4-H club and. Did a lot of different things there. So,
my mom was one of 7, and I'm just wondering: do people who have farms have a lot of kids? They have the extra labor.
Well, it used to be. That used to be, and my mom grew up on a farm about 150, 200 acres in Crozet, and I would say it was because I remember visiting when I was young with her to her family farm and meeting, her parents, my grandparents, and. It was very much like the Waltons on TV. I mean, and actually not that far. So, but yeah, I think so. I think, and maybe there were simpler times. At least that's what we like to say, isn't it?
So you move to Lynchburg, you get the job at Virginia Baptist, and at that time, Virginia Baptist and Lynchburg General, 2 very, very different, separate operations.
Yeah.
Talk a little bit about like what the whole healthcare system in this area was like when you got here, and at what point you started to identify the opportunity to maybe bring everything together like you wound up doing.
Well, if the history of Lynchburg hospitals is quite interesting. There's been a couple of good books written on that. Dr. Peter Houck wrote some really interesting books that are out there publicly available. But at one point there were 7 or 8 or 9 hospitals in Lynchburg. Of course, Lynchburg was a big hospital center during the Civil War. So there were a lot of hospitals that were, opened up, field hospitals and tobacco warehouses in different places. But in 1980, there were 2 what I would call acute care hospitals left. There were some other facilities that were still nursing homes. But one of those was Lynchburg General, which by 1980 was then a private nonprofit organization. It started out as a hospital organized as a pseudo-government entity under a Virginia law that allows hospital authorities, allows governments to support and found hospitals. Lynchburg General started mainly in the earliest days was kind of the hospital for the poorest of the poor. And Virginia Baptist over in Rivermont Avenue was founded by a group of Southern Baptist and related to the Baptist General Association of Virginia, the state Baptist organization. And by 1980, it had grown to be quite a large hospital, catered more to the wealthy. was had a lot of charitable support from some of the '03 Upper Lynchburg crust. But the hospital history is not that proud when it comes to racial matters for either facility. Virginia Baptist didn't admit their first black patient until the mid-'60s. Wow. And Lynchburg General was better than that, had admitted black patients for some time, but had a totally segregated ward. And the black or African-American ward, as it was known, was down in the basement of the hospital.
Oh, wow.
Which was a pretty common practice. Years later, our chief nurse at Centra was Golden Bethune, a wonderful black lady and who grew up in Tidewater. And she was here and did a great job for us for 5 or 6 years, and then was hired as the CEO of Riverside Hospital in Newport News. And when she went and took that job, her mother, who grew up there, said, Golden, what a day. She said, I remember when I couldn't go on the main floor of that hospital. I had to be in there. You're the boss. Mm-hmm. What a wonderful day. So the hospitals were very different. They also had kind of worked out a pseudo-cooperative relationship. It was cooperation, at least at one level. And so Lynchburg General had agreed that it was going to run the emergency department. Virginia Baptist had agreed it was going to be the obstetrical hospital and the kids' hospital. By the 1980s, that relationship was getting pretty strained, and it seemed to me pretty apparent either under laws, either the two hospitals were going to have to come together in some organized fashion as a single entity, or they were going to become much more competitive and duplicate services. Mm-hmm. Meanwhile, the physicians in town almost entirely in private practice, and then most went to both hospitals back and forth, and they also had feelings. So the whole milieu by 1980 was obvious that something was going to happen, but Baptist was struggling a little bit, kind of behind the scenes. It had some tough financial issues for a year or two, and the Baptist board, the lay board members, led by people like Sam Cardwell and Charlie Sackett and Roselle Schule and Bill Chambers from CB Fleet, were very much involved. Buster Baldwin, who was the founder of Edmonds Williams, you interviewed Ed Burnett. Mm-hmm. Mr. Baldwin was one of the senior partners founding that firm. So they were working very hard at Baptist. And, I had great growth experiences, great growth opportunities at Kingsport. I'd been able to work with that hospital and start a heart surgery program. We opened up a cardiac cath lab. I was at a young age. I was lucky to work on a couple of bond issues and, to sell bonds to improve that hospital, and therefore we knew Baptist was going to have to issue bonds. So I'd been through that process with bond underwriters. I'd been fortunate because my background was such that I landed in a spot in Kingsport where there weren't very many professionally trained administrators, so I got to do a whole lot of things. So that.
Yeah, and it sounds like, that really, and you said you were there, 4 or 5 years, and, everything that you did there really helped it laid the groundwork for, you coming to Baptist and kind of coordinating and organizing Centra.
Yeah, it was very helpful. I had a lot of experiences there that were helpful. I do remember there was one little issue, but we managed to work around it. I remember on one of the early interview visits, Mr. Baldwin, the attorney and board member, sat me down. We were having lunch at the Piedmont Club, and he said, he had this way of talking. He said, "Look here, Dawson." He said, "I see you teach Sunday school, and you're very involved in your church, but it's a Methodist church. And
that's a problem.
We're a Baptist hospital, and we're founded by the Baptist Journal Association of Virginia." He said, "Do you think if you came to Lynchburg, you probably would become a Baptist?"
Oh, so this was before you even got hired.
Yeah, this was during the interview from an attorney, which actually, because Baptist was a religious institution is a permitted question, even today would be permitted. But I said, well, Mr. Baldwin, I thought somebody might ask me that. And I said, to tell you the truth, I said, if I've been in the Methodist Church a long time. It's what I grew up in. If I was the guy that would change my religion just to get a job, you probably wouldn't want me anyway.
Right.
And he said, good for you. It turned out the board at Baptist had to be 80% Southern Baptist, but 20% could be other. He was an Episcopalian. So.
It was a setup.
I didn't know it at the time.
It was a setup. That's fantastic. So you wind up coming here and you start seeing these financial problems and these different issues, and the need for these two hospitals, Baptist and Lynchburg General, it's going one of two ways from what you just said, right? It was either got to get together and eliminate the duplication of the problems, or they're going to go their separate ways and compete.
Yeah. So as I mentioned earlier, I've written a couple of papers on this subject, but the federal policy and the federal policy of the times heavily promoted health planning, and so there were federal laws under the Johnson administration had been passed to promote federal planning so that healthcare facilities wouldn't unnecessarily duplicate services. And they gave rise to what's called Certificate of Public Need programs in many states, including Virginia. So that was one legal theory. The other countervailing legal theory was, of course, the Sherman antitrust laws.
So in essence, if Virginia Baptist is the children's and the
right. So if Virginia Baptist wants to open an emergency department, at that time it would have had to get a certificate of public need from the state of Virginia that would say yes, it's in the best interest.
And Virginia would probably look at it and go, Lynchburg General's got that covered.
I think it's unclear what they would say. They might, or the public, the need to promote competition. So the other kind of federal trend, here's health planning under one body of federal law and thought, and the other is Sherman antitrust, that it's for hospitals to get together and decide who's going to have the emergency department and who's going to have the obstetrical unit is a per se violation of the Sherman antitrust laws. It's market division, and it's outlawed just because you're a nonprofit healthcare, and it's not allowed. And those two theories were colliding at that time. And that's why it was going to go one way or the other, because either we were going to make this informal arrangement formal and become part of a single entity, or we were going to be forced competitive forces, but also legal forces.
So, and this is because of the way the laws are written.
And also the evolution of the economics, and also physician preference to not want to try to be on call. If you're on call for surgery or general surgery that night, you don't want to be on call at two different emergency departments. You want to be one or the other. You'd rather not be bouncing. So a lot of different things, and economics. So one of our first jobs was to upgrade to address the facility issues. And I'll try to go quickly here and not make this too long and boring. But the Baptist had had a big problem because they were under temporary permits because of fire safety issues. The old wooden construction of the main hospital, which was built back in 1927, was not adequately sprinkled and didn't have adequate firewalls, and had a center stairwell that's a lot of fire safety regulations. And so...
Sounds expensive.
And the operating room was right there and just... behind the front lobby, which is the main, right under the cupola. And I remember when I toured the hospital on my first visit, I walked through the lobby, and then the doors opened into the holding area for the operating room, and then right into the ORs. And the doors, it was enough privacy, but one of the problems was that was flies, and so we had fly strips hanging on the OR lights because the flies would come in the front door and come all the way through. And, So
Probably don't want those in the OR.
yeah,
Right?
not the best place. So the hospital had been trying for a couple of years to get its finances such that it could issue a large bond issue. And so the first couple of 3 years I was working on that, and we ended up building what's now known as the Carter Building, which we did some fundraising. We got our finances together. We were successfully marketed bonds represented by underwriters here in Lynchburg, but also in New York, and negotiated those covenants, and were successful. And then English Construction, headed by Maurice Law, started and built the Carter Building, named for Jimmy and Jewel Carter, Mr. and Mrs. Carter. Mr. Carter was one of the early founding partners of First Colony Life here in Lynchburg, and made a large donation. And so then we were working. I'd recruited a couple of young people to work with me. Well, not young, not just because they were young, but they were really smart. We built a good team. We had Tom Jividen was my first hire, was a very well-respected, professionally trained hospital administrator from Florida, and moved here with his family. And Mike Barger was our chief financial officer. Betsy Jamerson and Diane Nash ran nursing. And we were lucky to apply for approval to open the first cardiac cath lab, so become the heart center for. And I was very fortunate to successfully work with Tom Naggard, who's still here. As a matter of fact, Dr. Naggard is chairman of the Centra board today, and he moved here. He could have gone a whole lot of different places. He was a fellow at the University of Virginia, and Dr. Charles Sackett was the senior doctor and cardiologist here. Said, "This is the guy we want. We know this young man. He's great." And
we got your guy.
We worked with him, and he helped us design the lab and order the equipment, and we installed the first cath lab, which meant that, all the stents. And then a couple of years after that, once we got that going, we successfully recruited Dr. David France, who's still in Lynchburg, and Dave started the cardiac surgery program. So now Baptist all of a sudden was moving ahead, and Virginia. And so those two ships were sailing along, and they were both doing pretty well, and they were both moving at pretty good speed. Whereas if one was moving and one was standing still, that merger would be, they were able to come together as equals. And the boards of both hospitals, led by the board chairs of each, and Ken White, who's an attorney, was the Baptist Hospital attorney, and he was on the board at Lynchburg General. Go figure. That's a little. But anyway, they were able to get it. Frank Mumaw and Jim Candler were the key board chairs. Some doctors played key roles in that discussion, like Charlie Sackett, like Paul Fitzgerald, and some others. People are still around. So 2.5 years, economic studies, legal studies, merged the hospitals in 1987. And a year and a half later, the two Roanoke hospitals considered merger and came to the attention of the U.S. Justice Department. And the Justice Department called on them and said, why do you think you all can do this? And they said, well, they did it in Lynchburg. So I was sitting in my office a couple of year and a half after the merger, and I got a call and said, well, this is so-and-so with the, with the Department of Justice. We heard that you all merged. Is that true? So they actually subpoenaed or pulled all of our documents. We had a whole truckload we sent to Washington, and at the time, the Justice Department was looking for a case or two to litigate this question of what was it going to be healthcare planning, or was it going to be antitrust? What was going to rule this? And they called our chair and our attorney Kenneth White up to Washington. We had an antitrust counsel too. We'd foreseen this might happen, so we'd really built our plans. And so they the head of the Justice Department, I wasn't in the room, but my understanding said something like this, looked at Mr. White and said, well, let me see, Mr. White just said, your defense of this merger is that it was not nearly as bad as the per se violation you had of the Sherman Antitrust Act before you merged. Is that right?
The lesser of two evils?
Yeah, and Mr. White said, I wouldn't exactly put it that way. He said, the way I would put it is that our two hospitals worked together in planning and came to the decision. We developed this reputation for excellent care at low cost. And we have the support of all interested parties, including Blue Cross of Virginia and the major employers and all the doctors in Lynchburg. Therefore, we decided this was the best way to do our job to serve her. But if you want to litigate that, the journey starts at federal district court in Lynchburg, Virginia. You got to decide, is that the case you want to try this national basis on? So 6 months later, they called up and said, no, we're not coming. And they instead had two cases, one in Roanoke and one in Rockford, Illinois. And Roanoke Carilion Health won theirs and Rockford lost theirs. So, and antitrust is still debated today. But anyway, enough said.
George, give me the overly simplified view of why this was such a good idea and why this made sense, bringing both of these hospitals together under the Centra Health brand and moving forward as sort of a one-stop shop entity, community-driven or regional-driven hospital in because now it's obviously expanded and it's in Gretna and Farmville, and we see all.
Right. Yeah, we did. We were in Farmville before I retired. We were in Bedford. We were in Gretna. But yes, so it's critical mass. So in order to have, let's take cardiac surgery. In order to have an excellent cardiac surgery program, as we started, you needed to have a caseload where your doctors did somewhere between 200 and 400 cardiac surgeries a year. And you needed that for a variety of reasons. One, to keep the team trained. But another is you needed enough volume that you could support at least 3, if not 4 surgeons. Because when you start, if you only have 2 or 1 or 2, they're on call every other night. And that's no way to live a life. And so you needed enough critical mass, enough patient volume to be able to recruit the top specialists, have them have a great place to practice to advance their careers clinically as well as financially. And the same would be true of cancer care. So you need to have a Pearson Cancer Center where you've got multiple linear accelerators and advanced chemotherapy and a trained team. And the same is true in orthopedics. So you need to be able to have a hand specialist and a hip specialist and enough people to be on call. And so the reality is that Lynchburg at that time, and even today, doesn't have the population base to support that level of care. So our idea was, okay, let's give Lynchburg a better healthcare system than you would think. Let's distinguish Centra by reaching out. And we know we've got Duke to the south and UVA to the north. That's pretty tough. We got Richmond, we got Roanoke. But let's figure out, how do we attract patients from a greater volume, number one. So we have the patient pools to develop those services. Number two, how do we diversify our services? How do we do things other than just acute inpatient care, so that we have a large enough organization to recruit talent that we need, not only clinically and in nursing and in different support services, but also in the leadership. So we grew our psychiatric service. So when I retired, Centra no longer has since sold Rivermont Schools, but Centra operated 16 or 14 campuses across the state of Virginia, Rivermont School. We have one here in Lynchburg today that's still named Rivermont School over by Home Depot. Mm-hmm. But we had campuses at Fairfax and Newport News and Southwest Virginia.
Just as kind of feeder programs for?
No, each one was filling its mission for its local community, working with the public school system to take their most behaviorally challenged kids and give them a private setting education with counselors and mental health. That's a concept we developed here. And then we were able to go and we didn't franchise it. We actually owned it and employed those folks across the state. We had a drug and alcohol treatment. We built the Summit across the street here from your studio, from your station. We had 5 nursing homes that we operated. So how do we diversify? How do we provide outpatient care? Bridges Treatment Center was out on Leesville Road, was for kids that were residential. So our idea was that clinically, this brings the best specialist for our community, but also for our region. But from an economic development standpoint, healthcare then becomes a major reason to come to Lynchburg. And if you're here for Lynchburg for healthcare, then maybe you'll go to the mall and do some shopping, and maybe you'll, employers, maybe a company will move here. Well, because the healthcare is extraordinary.
What was so obviously that's the pro, right, of bringing these two entities together to create a bigger, better healthcare environment for the Lynchburg area. What were the cons? What were the arguments against it?
Well, the argument against would be, I guess, that of any monopoly, that, wait a minute, there's competition makes things better. That if you're the only game in town, you can charge too much. Or if I don't like if your waiting time is too long at the emergency department, I have to drive all the way to Danville or Charlottesville to do something about it. And I think at that point, as a nonprofit healthcare system, for any community, not just Lynchburg, but for any community, a great responsibility falls not only on the administrative staff, but on the board of directors. So Centra is a true nonprofit. It's a big one. It's a big nonprofit, but the board members aren't paid. They're community volunteers, and their job is to keep their eye on the administration, on the CEO, on the doctors, on the services, to represent the community, to understand when we ought to put our money into new facilities, when we ought to put our money into making sure we have enough nurses, what our waiting times are for this service, what's our policy when it comes to women's health, et cetera. So a plethora of interest. So the balance, that pro and con, the balance then, in my view, much of that balance then falls on the board and the board of directors. And so I think it's very important. One of the things that I was blessed with were boards that were wonderfully committed, wonderfully engaged, and completely community representative, representing the community, not their individual interest.
Question on the monopoly side of things. And, what you said, makes a lot of sense, right? I mean, is the wait going to be too long? Is are the prices going to be too high if there's no competition there, right? That's the natural question. The one that I've got, and it seems to have continued to evolve since you've been gone, but you mentioned the orthopedic group. We now see all the orthopedic surgeons under one umbrella, right, which is Ortho Virginia.
Ortho Virginia has offices across the state.
Right.
Yes.
But I'm just saying here in Lynchburg. So the question that I would ask is, we do see, people going to Charlottesville, going to Duke, or maybe even Richmond. But even just for a second opinion, you really have to travel somewhere else because if you go to Ortho Virginia, for example, right, you're not going to go next door to the same guy who's in the same, in the same organization, because I would feel like he's not going to tell me that his partner's wrong. They work for the same place.
Well, they might. But and most doctors I know are glad to have patients who are not sure how they feel to get a second opinion. But to your larger point, if you're going to have a major procedure, if you're going to have a hip replacement or a knee replacement, you could choose to go to Duke or Charlottesville, or you could choose to stay in Lynchburg, or you could go to Richmond, or you could go to Roanoke. Reality is, if there were 2 hospitals in Lynchburg or 3 hospitals, all that were doing knee surgery or hip replacements,
Same guys?
Well, first of all, it might be the same doctors, but second of all, you probably none of them would be doing it because they couldn't
specialize.
They couldn't maintain the inventory. I mean, it's easy enough to say, well, how many, it's just one doctor and 4 nurses, and what is it? Well, yeah, how many different sizes of knee prosthetics do you have to have so you make sure when you're in there you get the right one, or what kind of specialized equipment? So I think across this country, we see major medical centers developing, and then we see rural health. But here's the problem, which I think is a bigger problem than the problem is primary care. And the problem is that with the federal reimbursement cuts that we're seeing in the Medicare and the Medicaid program, hospitals not only in Farmville, Virginia, or rural retreat, not only the very small hospitals, but hospitals in Lynchburg are going to be close to the bone. They are going to be struggling, and I'm very concerned about. And the people I know, I'm not involved today at Centra. I'm not on any Centra boards. I told you when I agreed to this interview that I could not speak, and I'm not speaking for Centra, but speaking for George Dawson. I'm concerned about how hospitals in communities our size are going to make it. So let me give you a reality is that patients who have private insurance carry the weight. They are the patients that generate enough financial benefit to the system. And patients who are on Medicare get by, and Medicaid, particularly before COVID, and maybe now with new rates, often doesn't pay your full cost. And then you have a large percentage of patients that don't have any health insurance, and they have to be treated. There's a federal law that says when that patient goes to the emergency department, they have to treat that patient. It's called EMTALA, the Emergency Medical Treatment and Active Labor Act. So communities that have the term in the business would be payer mix. Communities that have a lot of Medicare, a lot of Medicaid, a lot of patients with no insurance, and fewer percentages with private insurance are going to struggle. Communities that have...
Is that Lynchburg?
Yes, that is Lynchburg.
It is Lynchburg.
It is Lynchburg.
So
yes.
A vast minority of the people have private insurance in Lynchburg.
I don't have percentages off the top of my... But I would say it's might be 50, 60% of Centra's business, depending on the service. In obstetrics, it's probably less than that. So those... and you compare that... I have a fellow I know who recently moved from Lynchburg to Fredericksburg in a leadership role in the healthcare system. And I was talking to him, and he said, "You won't believe our payer mix. We're like 80-20.
Wow. Okay.
Okay. So this is Northern Virginia,
Yeah.
So when people hear these debates and about the great big beautiful bill and what it's going to do and how much money we're going to save, those chickens are going to come home to roost if we aren't really careful when it comes to protecting our services for communities. And it's not just going to be that small hospital in West Virginia. It's going to be right here in Lynchburg if we aren't careful. So it's a good time to be aware and to be listening and to be asking your questions. And it's a good time for the boards of directors to try to make their needs known.
What are you most proud of from your tenure at Centra?
Oh, the people.
The people.
People. Yeah, the people. What wonderful people. We were, in our last few years, it was wonderful. We had, I retired in, 15 years ago, to say early 2012, really, really late 11. I had a little health hiccup we can talk about if you want. But during that period, the national guru was a fellow named Don Berwick, and he ran a big national research organization looking at performance. And he was picking the best hospital systems in the country based on what he called his triple aim. And they were quantitative measures looking at cost of care, patient satisfaction, and community mortality rates. And Lynchburg was, on his top 10 list.
Wow.
So, and that was a testament to the people, not to George Dawson, not to some building, but to everybody in the team that was together. It was so much fun. It was so much fun. I just loved working with those folks.
You had an amazing run, first at Virginia Baptist and then bringing Centra together as the CEO. You said you left in 2011, which is about 14 years ago. The stability, let's just say the stability at the CEO position since you left has not been the same as when you were there. And I know you said you're not super involved with Centra anymore, but, looking back on it now from where it was when you were there, what do you see?
Well, the first thing I see is Richard Tugman, who I have a lot of confidence in, and I think has brought stability in his leadership to the system, and he understands our community. So I wasn't part of that decision, but I support Richard. And, I had a great story about him. I heard a great story in the community, talking to a friend who works in the emergency department. And Richard was named as the interim CEO, and like a week later on a Sunday afternoon, he was in the emergency department because of some issue that had come up, and spent a couple of hours there dealing with this issue. And a friend of mine who I play golf with made a comment, said, one of the doctors said, "You're Richard Tugman, you're the new interim CEO, is that right?" He said, "Yeah." I said, "Gee, your predecessor here is 2.5 years, and I never saw them here." So Richard's a great guy. I think Centra, in hindsight, had a couple of tough choices made. One of which was financially the decision for one of my predecessors to install a certain information system to handle not only billing but all health records, and the connection between the billing and the health records is crucial. And I don't think it was handled as well. I'm not saying the choice could have been different. It could have been, but they had a tough period of time in which they had trouble getting bills out and collecting bills. They lost some insurance payments they could have gotten, and I think financially they got behind the 8 ball a little bit. And I think some of my predecessors sort of didn't understand. Well, I'll put it this way. I'm a big believer in relationships, and no deposits, no withdrawals. And if you're turning over every 2 or 3 years, I certainly had my issues, and it was nice when I retired and all these people were my friends and they talked all the great things you did. And I said, "Well, do you remember this time? What about that time?" Yeah. But now, well, the reality is that even at the worst of times when we were, we had some hot issue we were really fighting about. We had some upset doctors. We had an internal battle when we went to establish a separate women's health breast cancer program, the whole mammography program. We had some disagreements about that within the radiology group. But even during those tough times, we could draw on years of working together and relationships. So we had some deposits that we can make. But if you're only here 18 months, so I think a lot of turnover, and I frankly think connecting all the way up and down. So the sense of connection from the CEO all the way, to every employee. We had, 6,000 people. I'm not here to tell you I knew 6,000 names. Of course. But I knew a lot of them. And
but you talked about relationships being important, and obviously, the stability comes with that, right? I mean, the longer you're there, the more people you get to know. That's right. That only makes sense.
And, try to be visible, try to make rounds. I spoke to every new employee. My last 4 or 5 years, we onboarded new employees, unless there was some highly unusual circumstance, started on Monday morning, and with a day-long or 3 or 4 day-long orientation. And I was the first speaker on Monday morning at 8 o'clock for every group. So
dive right in.
Yeah.
Dive right
and,
in.
and here's what we believe. But anyway, that's easy to say, but I think at the end of the day, it comes down to relationships and people. So,
you said you're well, you didn't say you were a fan, but you like the hire of Richard. You think he's well positioned, and well, let me ask you this: with him at the helm, and knowing what you know, because understanding it's been 14 years since you've been directly involved with Centra, but knowing him, knowing what you know about the healthcare industry, what we've talked about with Medicare and Medicaid, how's Centra positioned right now moving forward, in your opinion?
I'm not sure I know enough inside to answer that, to be honest with you. I would say this, that every system in a community with demographics and insurance payment and populations like we have in Lynchburg is going to struggle if we don't address some issues. And, I think I think that everybody deserves health care. And so I'm increasingly of the belief that health care should be available to everybody, primary care. I said this, and I'm going to digress just a minute. And do we have time? How are we doing time-wise?
Yeah,
right?
We're good.
Okay. I said I had a little health hiccup after I had announced my retirement. Actually, my successor, my immediate successor, had been hired already, but I had a pretty serious cancer, and it was discovered quickly, and I found myself within a 3-day period from being totally immersed in getting the operating budget for the hospital worked out for the next year to talking about where I was going to have pancreatic surgery and where I was going to go. And I ended up going to Hopkins because at the time the Whipple procedure I needed, there weren't any Virginia hospitals doing more than 100 or 2. And John Cameron, my surgeon, did personally 2,000 or 3,000 Whipples.
And that's one of the things you were talking about before, needing to have the repetition to stay sharp and all that.
But that was the surgery. But for the radiation treatment and for the chemotherapy at Hopkins, they said there's nothing you need here that they can't do in Lynchburg just as well. And I came back and I got my chemotherapy from Dr. Dwight Oldham and the cancer group, and Joey Hilliard and her partners in radiation did my radiation therapy. So I'm lucky, right? First of all, I knew the right questions. I worked for an employer. I'm wealthy. I'm not wealthy, but was lucky to have health insurance then and to qualify for Medicare shortly after that. And I could afford the care I needed. And I knew it should not be the case that because I'm privileged, I get that treatment. And somebody who lives somewhere else in Lynchburg, because they have different circumstances, they don't get health care. There's no understanding I have of the world we live in or my value system or my religion that makes it okay for me to have care and you to go without. And yet in our country, we have a system that's based on that philosophy. I agree. You shouldn't stay at home. Should you work in order to have health insurance? Okay. But you ought to be able to have a primary care doctor. I mean, when I started turning yellow and jaundiced, I went to my doctor and he looked at me and said, "George, I think you're jaundiced and that's serious. Let's get you a CT scan right away." If it had been a month before I could get an appointment, how would that have been different?
Who's got a better system than we do?
What country?
Yeah.
Oh, Canada, better than us. I think Great Britain's probably better than us. At least there's a floor. Okay. My point is, okay, we can talk about the ceiling, but there ought to be a floor. There ought to be a floor that says that when it comes to the basic care, that kids and adults can get care, and that and that's made available in such a way that there's human dignity. One of the reasons I'm supportive of the free clinic, by the way, is they're working to do that. But we shouldn't. We were just talking about this little benefit Rosemary and I did at our house to help the free clinic.
Yeah, I wanted to get to that.
Yeah, well, my son, who also has a background in healthcare and consulting, but he used to have a saying I liked, and he said, it's going to be a great day when we have a bake sale so we can build a new hospital. Like we have to have a bake sale for schools, I mean, there ought to be basic level healthcare availability, and there ought to be at least a floor. I believe other countries, there is a basic insurance, and then there's an overlay of private insurance. So, you know what? If you're fortunate enough that you can have private insurance and you want to get a specialized treatment faster, okay, maybe so. I would say community college versus private school. Is there an analogy there? I mean, maybe.
Yeah, and don't get me wrong. I am not in a debate with you on this because my knowledge of the healthcare in other countries is very minimal. But what I have heard about some of the ones you mentioned were, the wait time.
Yep.
Right? Regardless of who you are.
There are some wait times.
You need a procedure and, you may not get it in time to survive.
Yeah, I didn't say perfect. I said better.
Okay.
Yeah,
and like I said, I don't know. So
and
I bang the microphone.
Actually,
Sorry,
I'm glad I think our world would be much better if people who had different views could sit down and talk about them more often with each other without castigating and naming and assigning blame and character assassination. But another issue is medical training. So I was thinking about things just to throw out there as a deeper subject that we have time for. But we've had the growth of medical schools, both MD schools and DO schools, like the one at Liberty in this country, so that you would think there would be more doctors. And yet what we see is fewer and fewer specialists available.
I was telling you earlier, maybe off the air, that both my boys are in college, and one of them was interested in all the advice he got from doctors was be a PA.
Yeah.
Be a PA. It's less school. It's less expense.
Yeah.
It's more hands-on care with patients, and it's less paperwork because apparently, and I don't know this for a fact, but what I've heard is doctors spend way too much time nowadays doing paperwork.
There is that feeling. So the PA program, we have two in our community. We're lucky. We have one at Liberty, and we have one at the University of Lynchburg. I helped the folks over at Lynchburg start that program.
Did you?
One other thing I was going to say, though, is we've had this growth of medical schools, both MD and Doctor of Osteopathic schools like the one at Liberty. What we haven't had as much growth is approved residency programs. So we have more medical graduates, but then fewer residency slots. So if you want to become a surgeon, a urologist, a cardiologist, a infectious disease specialist, whatever, there are relatively fewer places, more competition for those slots. So are we really getting people? I mean, I think there's a lot we ought to be talking about in federal policy there. A lot of it gets down to the cost of training a doctor. So historically, a lot of those residency costs before 2000 or programs that were started before the year 2000 had significant federal assistance. Newer programs have less. I don't know. Is it the national interest to have well-trained doctors? I think it is. Should they somehow make sure they pay back in terms of service and financially? Yeah, probably. I mean, there's probably some interesting political something to dig down into. You ought to call. You ought to get some people from Liberty and maybe some doctors from Lynchburg to talk about that for one of your future shows.
Yeah.
The availability of graduate medical education.
That's right now at this point. That's way over my head now.
All right. Sorry, I won't try to run your program, your radio program.
Let me ask you this: AI in medicine.
Yeah, I don't know yet. I don't know. I do know, you're talking about paperwork. I do know that if you're a specialist, let's say you're a medical oncologist, your job is treating chemotherapy for cancer patients. There are so many papers published that if you'd have to go home every night and read for 6 hours just to keep up on the literature.
Mm.
So how does that figure in? I don't know. Is AI the answer? On the other hand,
well, I mean, they're even talking now about AI looking at scans or MRIs or whatever and pinpointing things before the doctors have to even get in there and do it.
I agree with that. I think how that AI is, quote, trained, how knowledgeable it is, is a real question. When I look at my phone and ask it a certain question, I may get an answer that makes sense, but it may be nonsensical because it wasn't trained very well. But you know what? We don't need AI to help us get a COVID vaccine. So I got my new rant is on COVID vaccines. And, we have the federal policy, and that's then what's covered. And at the federal level, we've decided we're going to end these emergency declarations. Okay, got it. Emergency's over. We decided that people over 65, though, probably as a class would benefit from COVID. There are 11 states that say, or maybe 13, that say, well, yeah, but if you're over 65, we still need to make sure you're who you are and who you say. So the way we're going to do that is we're going to require a doctor to write a prescription for you to get the COVID vaccine, even though you're in the age group. Rich, Virginia is one of those 11 states. Last week, I spent 4 hours trying to get my COVID vaccine, but until I got a prescription, I couldn't get it.
4 hours. Wow.
Yeah.
And every time I pull up to CVS, they're willing to just stick their needle out the window and just jab me in the arm, it feels like.
Yeah, well, I know. And that was under the emergency declaration. So in Virginia right now, you have to have a prescription.
You do? Okay.
Yeah. Walgreens has a workaround. Maybe CVS does too. I don't know. But Walgreens, I know, maybe Kroger. But Walgreens, when these regulations went into effect last week, when I was affected, took them the course of the day to realize they have a corporate doctor who is employed by Walgreens and who can write a prescription under protocol that if you're over 65. But when we were talking about AI, my throwaway line is, we don't need a doctor to tell Walgreens that George Dawson, who's going to be 80 next month, qualifies.
He's over 65.
You could look at my driver's license. It would do that. That's all you need.
I wanted to get to, and I know we've spent an awful lot of time. We could spend an awful lot more time on the medical and healthcare system and all that. But what you've been doing since retiring from Centra, and you talked about your battle with cancer, which obviously has gone well, as you're sitting here with me right now.
I'm very fortunate.
But you've been involved in so many different nonprofit organizations. I know you've chaired a number of fundraising campaigns, the ones that jump out to me, the Academy, and you may not have chaired both of these, but the Humane Society as well.
Yeah, we did. Rosemary and I co-chair the Humane Society. She's still on the board there, but we co-chaired the campaign that helped them locate from the old facility behind the stadium to build the new center out on Graves Mill.
Right.
They're working on some further developments right now, and somebody else is leading that.
And I'm just, hearing you tell the story, of what all you went through with the bonds at the different hospitals. Yeah. I mean, obviously the positions you held, fundraising is a huge part of everything, right? I mean, we joke that, no matter what you do, you're selling something to someone. But obviously that's near and dear to your heart, is fundraising for important causes.
Well, I'm lucky to be here, and I've been lucky to live in Lynchburg, and I've had the opportunity to be asked to help with community drives, like the Humane Society, like the Academy. There was a great team at the Academy. led by Jeff Kirshner, but George Zippel, Rob Taylor, a bunch of us worked really hard to sack at wood to save the academy. And there was a period in which, we caught the last train out, is what George Zippel says.
Really?
Yeah, we came through with the fundraising. Some people behind the scenes kept faith when everybody else was losing some donors. The city council stepped in, about a split vote, but stepped in and signed an agreement to support the development, recognized that the academy is anchoring one end of downtown. And then we raised, I think, $18.5 million, plus George Zippel raised another $8 or $9 million in tax credits, and that's why that academy's there. And look at everything, not only the academy but also related organizations are doing to make downtown a venue. And we got people driving in here from Richmond to see shows, and
yeah,
pretty cool.
It's a very cool, impressive facility. No question about it.
But yeah, I've enjoyed that, and let me say that a lot of what I do is for my benefit.
How so?
I'm not. When I retired, I said to Centra, "Okay, enjoyed it. Did what I can. I'm not that old guy that's going to hang around and tell you what you could have done or should have done. I want to live for today, and I want to live for tomorrow. And those opportunities have kept me really involved. I really involved recently. I enjoyed working with the Imagination Library, and the idea of the Lynchburg, the subsidiary of the Dolly Parton, but not a subsidiary, but a related party. So any kid between newborn to 5 years old, all they have to do is go online and sign up if they live in Lynchburg, for the Lynchburg Imagination Library. They get a free book mailed to their house every month until they're 5. So thanks to, in this community, we put together a fundraising to underwrite that effort. The city of the Lynchburg Imagination Library's job is to pay the basic cost of obtaining and mailing that book, about $25 per kid per year.
I saw the list of all the different nonprofits you're involved with, and it's amazing. How do you? And there are so many great ones here in Lynchburg.
Yeah.
And they're so well supported by this community. That's one of the things, again, not being from here, that jumps out to me is how well the nonprofits in this area are supported by this community. It's amazing. How do you pick which ones you get involved with?
Well, right now I say no to most everybody. I'm kind of not coming on any more boards, and I feel like I'm probably, when it comes to big fundraising efforts, I have to say I'm glad to provide advice, but I'm not going to be out asking. The problem I ran into is that my friends, I'd be walking downtown, and my friends would see me coming, and they'd cross the street and walk down the other sidewalk just so.
Oh no, he wants money again.
Yes. But I've worked on things where I thought, when I thought they were really in the best interest. With the Humane Society, it was pretty easy. Shortly after I retired, and then after my health improved, I got back on my feet. Rosemary, who was on the board then, said, "Hey, all these years you've been working for Centra. Now you need to do something with me. This is what we're going to do together." So that was pretty easy. With the Academy,
yes, dear. Is that the answer?
Yeah, that's right. The Academy, I did a kind of a private. They asked me would I help and would I throw my weight and name behind it and lead the effort. And the then board chair was a fellow I knew pretty well. I asked Terry to give me a couple of months in excess, and I said what I want to do is, before I put my name on the line, I want to know the feasibility. So I want to see your finances. I want to talk to your development staff, who's going to support this. I'd like to hear from your architects and what kind of cost estimates you have, so we know if we raise the money you say you want to raise, you can actually build this building. Mm-hmm. So I went through about a 2-month process privately there with talking to people, and then was able to issue a recommendation to the board to say we can do this, but we have to do the following things, and so it was kind of an agreement.
Gotcha.
Other things, less big things, do I have time? And I got some other things in my life. I try to play golf a little bit. I'm not very good. I try to paint. I have a studio.
You say you try to paint, but I understand you've won some things with your paintings.
I've had
watercolors. Is that right?
Yeah, I had some watercolors that did very well, and I've had some sales. And I paint in oils right now, and I've been fortunate that some people want to buy those. My accountant says my studio, which is listed as an ongoing concern, not a separate corporation, but we do have a business license, and we do pay our taxes. He said we need to turn a profit. We've been losing money every year. So, but the good news is that Van Gogh didn't sell but one painting while he lived, and that was to his brother Theo. So I've got a whole career after I die. My paintings might do great. So if you got one, hang on to it. It might be worth something someday.
That's awesome news for your heirs as well. All the stuff that's in the studio or whatever, it's go. Okay.
Yeah. All those scribblings.
And cooking as well.
Yeah, I like to cook. Yeah,
you like to cook the fancy stuff
Well, I do. I cook every day too. When I retired, Rosemary again said, "Hey, I think you should pick one job around here, kind of household job. Now that you're not working gainfully employed anymore, you ought to." So I picked. Okay, I'll cook dinner and I'll do the grocery shopping related to that. So I every night, if we're not eating out, I've got to. Matter of fact, when I leave here, I got to figure out what's for dinner tonight. We had stuffed peppers from the garden last night. They were pretty good.
That's fantastic. I'll have to make sure that Trish does not see this part of the interview. I don't need any deals like that, George.
Well, you're a long way from retirement.
Longer than I'd hope. Let's say that. But yeah, I mean, cooking, and you were just telling us earlier, and I heard you sharing the story with Mary as well, that it was working as a fundraiser for nonprofit. You were cooking for professional chefs. I mean, that's talk about pressure.
It was the free clinic. Asked us. They had a fundraising activity this summer down at the Glass House, and they had some auction items. They asked us to donate the live auction items, which was a wine and food tasting event for 8 people. So Lloyd Agnew, a friend of mine, and I agreed to work on the wine. So we hit all of our friends who we knew had cellars up to donate a bottle of wine or two, and they all came through. It was very nice. And then I put together the menu, and Lloyd coordinated the wines, and I had a couple of other friends come over and help serve, and there's some spouses who came and helped serve. So we had a nice dinner for 8 people, and it was 9 courses, and 2 of them were professionally trained chefs working in the food industry. And it was a little pressure. We were doing pretty well. Everything went, it's okay. By this time, the guests had their first courses out in the garden, and now they were in our small dining room, which is right next to my kitchen. That's when I hit the handle of the fat that had the rendered bone marrow fat on the stove, and it went up in there and then down on the floor. And it was a tragedy on several levels, I'll tell you. The first was that I had started with 10 pounds of bone marrow, 10 pounds of bones that I had obtained from Ben Coleman's farm up in Sedalia to render the fat from. And so it was a loss on that level. It didn't burn me badly, so that was okay. But it was all over the kitchen floor. But we have a wood floor in our kitchen. It has never looked so good. So if you would like to have a new shine on your kitchen floor, I would recommend bone marrow fat that's been rendered. It took us about cooking the bone down and rendering the fat and collecting that and then process. That was about 5 hours work that went.
Wow. Wow.
What can I say?
But the floor looked good.
Floor looked good. It's all right. All's well that ends well.
What's next for you, George?
I don't know. We're heading to Montana next week to see our son and some family and try to do a little bit of fishing out there and try to clean up my garden and get that in shape and maybe be in the studio a little bit more this fall. But I'm wide open to try to keep myself open to possibilities in life. Not that I think I can do anything about this, but one thing I would like to say before we close is how I just wish, as a country, we could not talk to each other, but listen to each other. I think we do plenty of talking.
Mm-hmm.
There's just not enough listening and not enough kindness and too much character assassination. We ought to be able to disagree agreeably. We ought to have different ideas. Those are good. We ought to be able to listen to each other. Maybe never agree, but we don't have to castigate and assign character flaws and demonize each other. And so, as I said to recently to at an event I was with at Mary, my theme song these days is "This Little Light of Mine, I'm going to let it shine," just wherever I can.
Does it feel like we've just gotten too far away from common sense, which kind of feels like the middle ground, and everybody's so polarized that?
Yeah, and it's easy to blame it on, the internet and social media, but I do think we're listening. Instead of listening to each other, we're listening to people who would like to polarize us for their own benefit and take advantage of us. And we need voices that somehow have the credibility to cross the chasm and bring us together. I'm not sure I know who that is on a national level or even a local level. If I had a magic wand, that's one of the places I would wave it.
Yeah, I mean, it seems like, now to your point, if a certain person on either side says anything, they're automatically dismissed as that person has no idea what they're talking about just because who he or she may be.
And, the truth is that every one of us, first of all, we're more complex than that. So our belief system and and what we do is more complex. So it has some of this and some of that and some of that. So it's back and forth. And so if I assign a single value to any person, that's who they are, then I'm wrong in the face of it all.
You're missing the bigger picture. Yeah.
And then second of all is it seems like we're not in spaces together enough and giving ourselves the timing to listen. Our evolution has wired us as evolved species to make assumptions and to assign classes. And so if I'm, if I'm back in the jungle, right, and I see something big and dark jumping at me, it's okay for me to say that's probably a tiger. I better run, right? But we're not living in the jungle anymore. I mean, we're better than that, and we should not use our labels to paint each other with as quickly as we do. So that's my soapbox, my little soapbox for today.
It'd be nice if we could get there.
It would be
sooner rather than later.
I told you the story. I'll quit with this. I'm not sure it makes my point as well as it could, but we were cooking this dinner the other night, and after dinner, the chefs and helpers were all sitting around having a glass of wine, and we had this conversation that broke out somehow about what kind of mayonnaise was best. And there were ardent supporters in the room of Duke's mayonnaise, and there were just as ardent, outspoken supporters of Hellman's mayonnaise. And I just sat back there in awe and listened to them debate this issue. And then I thought to myself, wouldn't it be wonderful if the only thing we could argue about and didn't agree on in this country was mayonnaise? I mean, there's so much we have in common at both ends of the spectrum. And you know what? We're all blessed. We're all privileged to be born in this country. Start with that.
Yeah.
Start with that. So how do we make it better? Hey, glad to be here. Thank you.
For the record, I'm a Hellman's guy. How about you?
Yeah, not Miracle Whip. I got Dukes in my refrigerator right now.
You do? Okay.
Yeah, but I'm not sure. It might have been just the last. I'm kind of a switch hitter, which actually, I vote for both candidates, and I don't belong to either the Dukes party or the Hellman's party. And it depends on the candidate. That's how I vote. Yes.
Independent. George Dawson, thank you very much.
Thank you, Rich.